So whenever we talk about ACL injuries, we are aware that there are several types of meniscus injuries. And the one that we know in terms of stability seems to be very relevant is the root tear. And classically, the ACL injury occurs combined with the root tear of the lateral meniscus. And that's actually what we're trying to demonstrate. Number one, how to restore the fixations or the footprint of the posterior root. And here I would like to show a couple issues that are important, especially when you combine it with an ACL reconstruction. So number one, I mean, obviously arthroscopically, it's a two-dimensional picture, so it's important that you have your landmarks that help you to guide you to the anatomic footprint of the posterior root of the lateral meniscus, which is a PCL. And it's the lateral spine, so you have to be medial of the lateral spine in front of the PCL. But when you look on the right picture, I think what is really important is to point out that the tunnel for the ACL and the footprint for the root are not at the same location. So yes, the footprint of the lateral root is pretty large. However, and I will show that when we do the arthroscopy, that it actually starts back here. So that's where the mechanical strength occurs. It doesn't help me to put a tunnel right here if the mechanical insertion side of the posterior root is right here. So some people suggest that it is possible to actually pull the posterior root of the lateral meniscus into the tibial tunnel of the ACL. I strongly advise against it because it's non-anatomic. And I think that's what we're trying to do. And therefore, it's important that you first establish the tunnels of the ACL reconstruction and then establish the tunnel for the posterior root in order to avoid divergence of these two tunnels as shown here. Another very helpful tool is that you have a drill guide, which has a very low key drill guide. That means that the tip is small because often the space in the notch is limited. When you do an ACL reconstruction, you're going to remove the ACL, so it creates more space. But for example, if you do a medial root repair, you're happy to have a low key curved drill guide. I typically like to keep the camera in the lateral portal and then come from medial to get to the posterior horn of the lateral meniscus. As I said before, it's important to avoid tunnel divergence. You see in the larger green color the tibial tunnel of the ACL reconstruction. Then I tried to tilt the tunnel for the root repair more medially in order to get away from the tibial tunnel. Later on, we're going to try to take the arthroscope to go into the tunnel to show you that there should be no tunnel divergence. Here's a brief video now how to augment the posterior horn. There are now devices available from different companies. I personally like the First Pass Mini. It allows me also to stitch a loop right through the posterior horn, as I will show you later on, to create a stable fixation and placement. Oh, here you see it of the tape. It's an ultrabraid tape, which is then going to be pulled through the tibial tunnel. And finally, there's going to be a fixation to the tibial cortex, which can either be done by a button or an anchor. Some people even suggest it just time to the augmented sutures of the tibial ACL part. So that's pretty much it, what we're planning to do.
Well, thank you so much. And I totally agree with you that maybe you should perform your, that you should drill your tunnels first and then drill the tunnel for the meniscus tear, meniscus root tear. But one potential pitfall is that you can lose a lot of water by doing this. Is it a problem or don't you think so?
So, I mean, if the vision is good, you could just look with air. You don't even need water. Or, I mean, there are different devices you can stuff into the tibial tunnel that just avoids the leakage. So there's several options. You can take my finger, put in, or the assistant's finger, I guess, as it is your preference.
That's a good tip. I like the finger.
That's the best instrument you have.
Okay. Perfect. So your conclusion of this operation was that if you cannot treat the meniscus, you should not operate ACLs. And I totally agree with that. So let's see how you do it. Let's get started. The stage is yours.